Basiliximab, also known as Simulect Vial, is a medication used to prevent organ rejection in individuals who have undergone a kidney transplant. It is typically taken in combination with other medications, such as cyclosporine and corticosteroids, to help the new kidney function properly. This drug is classified as an immunosuppressant and works by slowing down the body's immune system to prevent rejection of the transplanted kidney. It is important to follow the prescribed dosage and take the medication at the recommended times for optimal effectiveness. The Simulect Vial is administered through an injection into a vein by a healthcare professional. Typically, it is given in 2 doses. The first dose is given within 2 hours before the transplant surgery, and the second dose is given 4 days after the surgery. The dosage of this medication is determined based on your age, weight, medical condition, and how you respond to the treatment. Simulect Vial is used along with other medications, such as cyclosporine and corticosteroids, to prevent the rejection of transplanted organs. It is important to take all medications exactly as prescribed by your doctor. If you have any questions, don't hesitate to ask your doctor or pharmacist. If you experience nausea, stomach pain, diarrhea, constipation, or pain/redness at the injection site, it's important to inform your doctor or pharmacist. This medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, the use of medications that affect the immune system may lead to an increased risk of infection or certain types of cancer. It's important to tell your doctor right away if you experience any serious side effects, such as cough/sore throat that doesn't go away, fever, weakness, swollen glands, night sweats, unusual lumps, sores around the mouth/genitals, pain with urination, vision changes, or unexplained weight loss. While a very serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, unusually fast heartbeat, sneezing, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not listed, it's important to contact your doctor or pharmacist. Before using Simulect Vial, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have had certain infections in the past. If you have previously been treated with Simulect, you may be at a higher risk of experiencing a serious allergic reaction. Be sure to consult your doctor or pharmacist if you have received Simulect in the past. If you do have an allergic reaction to the medication, do not use it again without consulting a healthcare professional. Before undergoing any surgery, remember to inform your doctor or dentist about all the medications you are currently taking. It's also important to avoid immunizations or vaccinations without the consent of your doctor, and to avoid close contact with people who have recently received oral polio vaccine or flu vaccine inhaled through the nose. If you are pregnant, discuss the risks and benefits of using Simulect with your doctor. If you are a woman who may become pregnant, it's important to use effective birth control before, during, and for 4 months after finishing treatment with this medication. Additionally, consult your doctor before breastfeeding, as it is unknown whether this drug passes into breast milk. It's important to be aware of potential drug interactions when taking Simulect Vial. This medication may affect how other medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and over-the-counter medications, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to consult with your doctor before starting, stopping, or changing the dosage of any medications while using Simulect Vial. If someone has taken too much Simulect Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to monitor your kidney function with lab tests while using Simulect Vial. Make sure to attend all medical and lab appointments and consult your doctor for more information. Remember, it's crucial to take each dose of Simulect Vial as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist immediately to get a new dosing schedule. This medication is typically given as an injection into a vein, and the dosage is based on your weight. It is often administered prior to a kidney transplant to prevent rejection, and it is usually given within 24 hours before the transplant and then again on days 4 and 14 after the transplant. Always follow your doctor's instructions on when and how to take Simulect Vial. This medication, Simulect Vial, is typically administered in a clinical setting and is not meant to be stored at home. It is used to prevent rejection of a kidney transplant in combination with other medications. The dosage and timing of administration will be determined by a healthcare professional based on individual factors. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.